prevention of heart disease is a critical approach to what we do at the Emory Heart and Vascular Center. We are, as a population, unfortunately, at high risk for blood vessel disease. 1 out of every 2 men and 1 out of every 3 women will go on to experience some type of heart or blood vessel problems in their lifetime. The important fact is that we can identify the risks for this disease early, detect it early, and importantly, through a combination of lifestyle and behavioral approaches and medical approaches when needed, prevent this disease from occurring. There are some what we consider traditional heart risk factors, and you should be aware if you have these factors, or certainly should be checked by your doctor to see if you have risk for heart disease. If you have high blood pressure, even borderline high blood pressure, diabetes or prediabetes, if you're a smoker, if you have a family history of early heart or blood vessel problems, these would all be considered traditional heart risk factors that you should be aware of. If you have high cholesterol or an imbalance of a low good cholesterol and high bad cholesterol, these are also important factors for you to be aware of. The good news here is that if you've been a smoker, it's never too late to quit in terms of your heart risk. Within 6 months of stopping smoking completely, you can reduce your heart risk very close to that of a non-smoker. Now, some important points about smoking and heart disease in general. Unfortunately, all vehicles of tobacco, whether it be cigars or cigarettes or chewing tobacco, do increase your risk of a heart attack or stroke. And a single cigarette often can cause your blood vessels to become unhappy. We've done some of these studies in our cath lab where smoking a single cigarette can cause the arteries to spasm. It can cause the platelets in our blood to get sticky and cause our arteries to have some problems with the relaxation of the vessels. And so I get asked frequently from my patients, well, what if I just smoke a few cigarettes on the weekends socially? My answer is you're still putting yourself at risk. The classic symptoms of heart disease are ones that you probably have all heard: crushing, substernal, chest discomfort, pressure on the chest, feeling sweaty or nauseated, getting short of breath, feeling like you're going to faint or pass out. Now, the atypical symptoms, which are seen more frequently in both women and those with diabetes, can be just a change in your stamina, feeling tired, being short of breath walking up the stairs or hill when you weren't short of breath last week or last month. So these symptoms can be manifestations of many problems, but it's important to pay attention to yourself, and if there's a change in how you're feeling, that would be something to bring to the attention of your doctor, because that change can often be the signs or signals and warnings that something's going on with your heart. To screen for heart disease, one of the things we try to tell people is know your risk factors, know your family's risk. All Americans over the age of 20 should have a basic heart screen. That means a check of your cholesterol, a check of your blood pressure, identification of other potential risk factors such as early diabetes or overt diabetes, and clearly if you're a smoker, even at a young age, your blood vessel risk becomes magnified. Americans as a population, or those of us living in Western society, are at high risk for heart and blood vessel disease just by the lifestyles we lead. We're becoming a population at greater risk as we're becoming more obese at a younger age. We are developing more and more early prediabetes and diabetes. In our society, luckily, smoking has finally plateaued, but if we look at other areas of the world, the rates of smoking are dramatically increasing to to the point where heart disease will become the #1 killer worldwide. There are some ethnic groups specifically that we think of as a higher risk population. African Americans are higher risk for aggressive high blood pressure. Hispanics are often at greater risk for early diabetes or pre-diabetes. And so an important question to ask yourself is, has there been anybody in your family that's had diabetes or pre-diabetes? Is there a family history of high blood pressure? And if you're overweight or sedentary, these would be reasons to get screened for these precursors of heart disease by your doctor. So ideally, we like to prevent heart troubles before they happen, but we're very well equipped at the Emory Heart and Vascular Center to address cardiac rehabilitation in a comprehensive plan. We've developed a modernized program called the HeartWise program, which is a leader in cardiac rehab. We create an individualized plan for these patients, importantly focusing on modifiable lifestyle factors. We work with our nutritionists, our exercise specialists, our nurses, and importantly, we make sure that these patients are on all the appropriate medical therapies and have achieved the appropriate targets for their medical therapies for aggressive heart disease prevention. So what is LDL apheresis? This is a very specialized therapy, and it's akin to dialysis, where a patient with kidney failure gets the toxins washed out of their blood. This is a specialized therapy that only the Heart and Vascular Center at Emory provides in the whole state of Georgia. We were the first and still the only center in our state, and one of the few centers within the southeastern United States that provide this specialized therapy for patients with genetic cholesterol problems. So these are not the ordinary individuals who have moderately high cholesterol, but these are people who have genetically very high cholesterol, 300, 400, 500, sometimes 1,000. They have early heart and blood vessel problems or significant risk for early heart and blood vessel problems. We often have to treat these individuals every 2 to 4 weeks. We're able to take their cholesterol down from 500 down to 100 with 3 hours of treatment. But because of their genetic problems, the cholesterol will creep up over time, and so they are retreated. It's not a therapy for many individuals. In fact, 95% of the patients that are referred to the Emory Heart and Vascular Center for LDL apheresis luckily don't need LDL apheresis. They just need some guidance and direction for them and their doctors about a different or more aggressive approach to treating their high cholesterol. At the Emory Heart and Vascular Center, we've developed one of the first and leading centers for heart disease prevention in the country. And our favorite patient to see is somebody before they've had heart troubles, because we can help them begin to make changes. And those changes often don't need to be dramatic. You don't need to become a marathon runner. You don't need to become somebody that follows a completely vegetarian diet, but often by modest changes in your life, regular aerobic activity, by striving towards a more ideal body weight, and importantly, most of the time following a heart-healthy diet, which we consider a Mediterranean-type diet, healthy fruits and vegetables, low-fat dairy, heart-healthy proteins and fats, sparingly foods that have saturated fat and cholesterol, and importantly, regular physical activity. Just by following these healthy lifestyle approaches, you can improve your risk not only for heart disease, but many chronic diseases.